Absolutely. So please type in all of your questions. I have to say, Libby, that you're probably one of the most preemptive question answerers I've ever seen, because every time I wrote down a question, you had answered it on the next slide, because I tried to also come up with some questions as well. So we do have one. Let's see, let me just extend this so I can read the whole question at one time. What are the best practice tools that palliative care programs ought to make available for primary and secondary symptom management, medication, meditation, acupuncture, visualization, cognitive techniques, counseling? I'm going to toss in, is there a role for medical marijuana use in all of that? Can you talk a little bit about some of those things?
Sure. Well, so I think that, and I wasn't sure, Stephanie, did the question, was it inquiring about educational resources or just resources in terms of these actual services?
I think resources in terms of the actual, what do doctors usually prescribe? So how would somebody know to ask for certain things, to understand that perhaps acupuncture or counseling or visualization assistance might really help them? How would they know what to ask for if the doctor is not as well informed as you?
Well, that's an excellent question. And I'm not sure how concrete an answer we'll have, because I do think that sort of varies depending on the specific resource in question. And part of that depends on, there are a few logistical things and a few research or data-driven reasons for that. I think, so one research that I'd like to direct you to that I think is really interesting, that palliative care physicians love and that is available for free, that can help trying to think about the value of some of these techniques, services, schools of thought, etc., is something called Palliative Care Fast Facts. So it's a really cool resource that has had a home with different institutions or organizations over the years. But if you Google palliative care, if you do an internet search for palliative care fast facts, then you'll see that there are different fast facts about hundreds of different topics. So that's a great place to look at what does a palliative care doc think about meditation, and that could give you a hint about when it might be helpful. Same thing with acupuncture. I know that there are palliative care fast facts about a lot of these resources, and truthfully, what is being shared with the fast facts is existing medical data, but that is really what clinicians use to guide when it's appropriate, because we want to make sure that we're offering the right medicine or the right treatment or technique or practice for the right patient at the right time. And so those are some really boiled down ways to look at, okay, well, what does the research show that meditation is helpful with, and who and when? And so I don't think there's any other really clear repository that would point you to specific resources, both sort of conventional Western medicine and complementary things like, again, meditation, visualization, Reiki, etc. But that is one resource that I can direct you to that is probably the most centralized way. And I also know that there are some, I'm trying to think about what are some of the other resources that exist and are sort of housed within palliative care that might provide some data about these different resources. I'm trying to think about what that might be. So in my community, there is a community support organization called Turning Point that is local to the Kansas City metropolitan area. But another resource that I think often does host either educational or actual just experiences when to learn and or practice on a regular basis some of these skill sets and techniques would be something like Gilda's Club. Gilda's Club was founded in name after Gilda Radner, who passed away of cancer. But Gilda's Club they call themselves basically an organization to support anyone whose life is touched by cancer. And Gilda's Club locations exist all over the country in the U.S. and have calendars that are chock full of not only bonding times and support groups, but also times when they will have acupuncturists come in to speak. They will have yoga classes. They will have someone who will help with therapeutic touch or Reiki and things like that. And so I think that's another national organization that might have more local, that might be able to direct one to more local resources. And medical marijuana was the last remaining question, and that I would say is very controversial. And I think the reason that I think of it now as being controversial is I think there is still some, because it is considered illicit on a federal level, I can understand why some providers would feel uncomfortable about it. But I actually think just the lack of really high quality data to help guide people like oncologists and palliative care docs and pain management docs who are hungry for that data to know exactly when it's the right resource, for whom is it the right resource, and for what problems is it helpful. That complete lack of, not complete lack, but pretty great lack of high quality data does lead us to being pretty uncomfortable. I will say, I think the American Society of Clinical Oncology is coming around to that, and there are supportive care guidelines that are being published, and one of them I think is going to be about sort of medical marijuana, medical cannabis, et cetera, to try and give clinicians some information about how to prescribe it, how for patients to use it and when and for what and all of those things. But I think there is a big lack of that, but it's coming. And the American Association of Hospice and Palliative Medicine also is very eager to provide that data to everyone in the medical community and in the patient and caregiver community too. So I think you'll hear more about that.
That's amazing. So it really almost sounds like you have a whole menu of options within the scope of palliative care. And I guess that really depends on where you're located and what that team might have in their cupboard of resources that they could provide, I think, a little bit. So knowing a little bit about what some of these options are, I think was really beneficial in terms of looking at the breadth of services that the care program, palliative care program, could possibly provide. So this is great. There's another good question.
Also think,
my father.
Sorry, go ahead.
Go ahead.
The last thing I was going to say is I think the general palliative care philosophy is to ask us about a given resource, and if either we aren't the most knowledgeable people or we don't have access to it or we're not the right people, we will help you find it. We would rather be the go-to person and figure it out on the back end. So that's our general philosophy. So what was that next question?
Okay, so this is asking something a little more specific. One of the attendees' father has bladder cancer and he's 92 years old and in great medical condition. Can you speak to some options for palliative care for somebody who is also dealing with all of the other comorbidities of being older?
Mm-hmm. Absolutely. And what I am so blessed to work as a part of a urologic oncology team that my coworkers often will, my surgery coworkers often will refer these patients sort of like your father, to me to help look at the big picture and make sure that we all understand what is the most important thing to my patient, to our patient, and what medical care matches up with that. And actually, while it seems almost backwards to meet a surgeon and then before any other treatment planning happens, to meet with the palliative care doctor, it feels like you're skipping to the end in some ways of something that would be decided based on the treatment that's chosen. A huge aspect of palliative care training is actually in communication. And so what we do very explicitly is what really skilled clinicians do implicitly, which is get to the heart of, well, given what we're facing, what matters the most? And what does a good life look like? And where is the line? How are we going to know we're always having the right, that we're achieving an acceptable quality of life and making sure that the medical care matches up with that? And I think it depends on the area of the country and the sort of practice setting in which your father is receiving care. But I think this is sort of also dependent upon the urologist in question, but I personally see patients in this situation for preoperative counseling. And because I think it's just so important that we are taking a step back if someone is very medically vulnerable, regardless of age, but a nonagenarian typically will be somewhat medically vulnerable. And we want to make sure that we know what they care about, what they're willing to risk, and what they're not. And then from there, figuring out what does make sense and what would be a value add for their medical care, and sort of centering their medical care on that. So I think, again, palliative care consultation is very appropriate. A lot of times geriatricians do a lot of primary palliative care. Geriatric oncologists, I think, do a lot of primary palliative care, meaning, they may not have formal training in palliative care, but are experienced in looking at some of these issues. And I think a geriatric oncologist, a geriatrician, a palliative care doc who really, really knows your dad would be great people to sit down with and try and look at the big picture and figure out where the line is if there isn't a palliative care resource locally.
Thank you. I think that's great. These are all amazing resources. Remember that we will be sending out a link to the recording of the program so you can listen to it again, and we will be putting up a transcript in about a couple of weeks, and you'll get notification when that happens. So I'm going to take one more question. I just wanted to make a comment. There's somebody on here who said, why doesn't my oncologist or urologist tell us about palliative care? Most of us don't know when or why this may help us. And her husband has stage 4 cancer and is in pain constantly with neuropathy and doesn't have quality of life. So I really think that you address that throughout your conversation. So I wanted to end with one other question that I think is really promising and interesting. Is palliative care helpful for people dealing with the anxiety of having bladder cancer recurrences, even if there's currently no evidence of disease?
Wow, that is a really insightful question. Yeah. So I think palliative care can help. I also think, but to be perfectly honest, again, because we work in such an interdisciplinary team, one of the ways that we, at least in my palliative care practice with my colleagues, work is to try and figure out, again, what is the barrier to a good life? And then for someone who is really burdened by the anxiety of recurrence, which is, oh my gosh, it is very burdensome, and I wish desperately I could take that away. The group who I think would probably be the most helpful, palliative care, we might be able to help, but the people who I would turn to if I were anxious about a recurrence personally would be a psychologist, because a lot of what happens there are a lot of different schools of thought in psychology, but some of that is sort of trying to reframe things and come up with strategies for managing anxiety that are fruitful and basically prevent the anxiety from being so pervasive. And anxiety is a very modifiable problem, and psychology care is excellent at that. So I think while depending on what the local resources are, palliative care, we do have expertise in coping and support. Absolutely, that's part and parcel of what I do. And so I wouldn't say that palliative care wouldn't be helpful, but if it were me and I had one tool to use in that situation, I would see a psychologist. We have an oncopsychology program here, but this is bread and butter for people who are practicing psychologists. And I think this is a very modifiable set of burden that could certainly be alleviated.
Well, Dr. Wulff-Birchfield, this has been an amazing program. Thank you so much for joining us this evening to really help everyone understand more about palliative care. I'd like to once again thank the sponsors of our Patient Insight webinars, Bristol Myers Squibb, the EMD Serono Pfizer Partnership, Ferring, Genentech, Janssen Oncology, Merck, and PhotoCure. Thank you, everyone. It's been a pleasure having you with us. And please don't forget to complete the evaluation. I'm going to end the program now. Thank you all so much.